Good afternoon. Welcome to yet another live session with Needu's Academy. Vandana here. How are you all? How was your Easter? All good? So let me know about your Easter Sunday. How was it? I hope you all resurrected from your past traumas, emotions, experiences, your complicated situations and everything, right? Okay, let me know about it. How many of you have attended this session? May I know? Please comment. Okay, as I already mentioned, we are back after a great and holy week. Alright, so today as usual we'll be dealing with part A and part B. So ready to start the session? Alright. Okay. So we'll be starting with part B. So I'll show the screen. And you can read the question as well as the options and yes, the paragraph. Okay, and I'll give you 2 minutes for the preparation. You can do it. Okay, so you can start doing part B now. Okay, so the time is over. How was it? How was the question? Was it easy or tough? Okay, as you know, for the completion of part B, approximately we have 10 to 15 minutes or 10 to 12 minutes for the completion of part B. For the completion of part B and part C, we have 45 minutes in total. Am I right? Yes. Okay. So we are coming back to the question, and about the question, we have in total 6 questions, multiple choice questions, and as I already mentioned, we have 10 to 12 minutes to complete the answers or the questions. Okay, so I am just reading the question, and as you all know, first of all, it is very important to underline the keywords from the question as well as from the options and from the paragraph. Okay, so I am just reading the question first. So what point does the manual make about the latest anesthetic machines? That is the question. So as you know, this is all about a manual. Okay, so in a manual, we are reading for what? In a manual, we are reading for the main idea. Okay, so that is all about a manual. So this is all a manual, and what is a manual? A manual is all about a particular instrument or a machine or a device or medications, or we can say drugs. Okay, so this is all about a manual, and in a manual the heading is important always, and 90% you will get the answer from the heading itself. Okay, because it is not about a person, not about a staff or a people or anything, it is all about a machine or a device. Alright. Okay, so we are just reading the question first. What point does the manual make about the latest anesthetic machines? That is the question. And we have 3 options here. Option A, it has a lock which blocks the flow on nitrous oxide gas. Option B, it is designed to provide free flowing gases to the patient safely. And option C, it has an additional safety feature to deliver oxygen to patients when needed. So these 3 are the options. Okay. Yes, good afternoon everyone. Abhi Rajan, yes, commented main idea, very good. Very good Abhi, it is all about main idea, we are reading a manual. Okay. And we have a paragraph here, the heading is anesthetic machines. Okay. So as I mentioned, a manual is all about what? A device or an instrument. Okay. So or else it will be all about medications or drugs. Okay. So yes, I am just reading the paragraph. The anesthetic machine is used by anesthesiologist and nurse anesthetists to support the administration of anesthesia. The most common type of anesthetic machine is the continuous flow anesthetic machine, which is designed to provide an accurate and continuous supply of medical gases such as oxygen and nitrous oxide, mixed with an accurate concentration of anesthetic vapor, and deliver this to the patient at safe pressure and flow. Modern machines incorporate a ventilator, suction unit and patient monitoring devices. Pressure gauges are installed on the anesthesia machine to monitor gas pressure. Generally, 25% oxygen is always kept in the circuit delivered to patient as a safety feature. The device which ensures this minimum oxygen in the circuit is called hypoxic guard. Some basic machines do not have this feature but have a nitrous lock which stops the delivery of N2O in absence of O2 pressure. Machines give various alarms to alert operators. So this is all about the paragraph. Okay. So I hope you got an idea regarding the paragraph about this manual. Okay. So as I already mentioned, either we can do it in 2 methods. First of all, we can read the question, then we can read the options, and then you can read the paragraph. That is the one method. Or else you can read the question, then you can read the paragraph, then you can go back to the options. Okay, it's up to you. And yes, let's mark the keywords from the question. So tell me, what are the keywords from the question? Okay, a manual, already you know this is a manual, latest anesthetic machines. Okay, so I'll be marking 3 keywords from the question. It's all about latest anesthetic machines. Okay, so from the options, what are the keywords that you have marked? Okay, so what are the keywords? Yes, Tina, Thomas, Christina, Varghese, yes. What are the keywords from the options? Can you tell me, please? Angelina, Shiny, Abhi, Kavita, Sanita, Jia, yes. Tell me, what are the keywords from the question options? Option A, what are the keywords? Any idea? Okay, yes. From the options, what are the keywords from the options? Yes, tell me. Okay, you guys already commented the answer. Okay, I can see. Yes, but tell me what are the options from the keywords, from the options, keywords from the option, sorry. Okay, so from option A, I am just marking, it has a lock, okay, lock, which blocks the flow on nitrous oxide. So we can mark lock, then nitrous oxide, flow nitrous oxide. Okay, and from the second option, we are marking designed, provide, then what else? Patient safely. Okay, and from option C, maybe I am marking additional safety feature. Okay, so these are the keywords which you can mark from the options. So whatever the keywords that you are marking, just to understand the question as well as from the option and the paragraph. That is why we are marking the keywords, as you know. Okay, so what is the correct answer? What is the correct answer? Okay. Okay, Shiny, it is option B. Angelina, option B. Kavita, option B. Tina, option B. Christina, option C. Okay. Anyone with option A? Additional safety. Yes, Kavita, very good. Yes. Anyone with option A? No. So you guys are stuck in either option B or C, right? I got C. Okay, Abhi. Okay, fine. Okay, you got option C. So let's check. So as you know, we are doing elimination method here to complete part B. Okay, so what is elimination? We are just marking the, once again I'll tell you, we are just marking the keywords from the question, from the option as well as from the paragraph. Then we are reading the question thoroughly, then the options and the paragraph once again. Then we can eliminate according to the paragraph. Okay, already I told you it is all about a manual. Okay, so manual is all about a machine or a drug. Okay, so here it is all about anesthetic machines. Okay, so from the question we already marked latest anesthetic machines. So they have very clearly mentioned here it's all about latest anesthetic machines. Okay, so when you are reading the first line till where? Till flow 1, 2, 3, 4, 5, 6th line. Okay, we haven't seen anything related to latest anesthetic machines. Correct? Okay, so read the very next line. Modern machines incorporates a ventilator, suction unit and patient monitoring devices. So there we can find what? Something related to latest anesthetic machines. Okay, latest, modern. So what is it? Modern machines incorporate a ventilator, suction unit and patient monitoring devices. Pressure gogs, which means calculators, gogging which means calculating, are installed on the anesthesia machine to monitor gas pressure. Generally 25% oxygen is always kept in the circuit as a safety feature. So already you have marked some keywords from the options, right? So what are the keywords? Yes, already mentioned here, Kavita. Yes, additional safety. Okay, so what is additional safety? So the device which ensures this minimum oxygen in the circuit is called a hypoxic guard. Okay, some basic machines. The question is not about basic machines. The question is all about latest anesthetic machines. So you can eliminate or you can just strike off those lines. Okay, there is no connection with the latest anesthetic machines. Clear? So that answer is what? Modern machines incorporate a ventilator, suction unit and a patient monitoring devices. Pressure gogs are installed on the anesthesia machine to monitor gas pressure. Generally 25% oxygen is always kept in the circuit as a safety features. That is the answer. So how can we eliminate option A and B? Okay, option A is all about it has a lock which blocks the flow on nitrous oxide gas. There is a grammatical mistake, plus it is not mentioned here when you compare with the question latest anesthetic machines. Okay, so we can eliminate option A. So what about option B? It is designed. What is designed? Latest anesthetic machines are designed to provide free flowing gases. It's not mentioned here about free flowing gases. Okay, it's only mentioned about oxygen as a safety feature. That is all about modern machine. Clear? So we can eliminate option B as well. Okay, so the correct answer is option C. It has an additional safety feature to deliver oxygen to patients when needed. That is the correct answer. Okay, so yes. Okay, very good. Abhi, you got C. Yes, Alpna, you got C. Very good. Okay, Christina. Okay, so clear? Any doubts regarding the question and the answer? Is it clear? Okay, very good. Okay. Yes. Okay, so we are moving to part A. Okay, already you know about the material and the topic is bullectomy, right? Okay. So we can move to part A and that is all about bullectomy. Okay. So I'll show the material on the screen. Okay. All right. Yes. So today we are dealing with bullectomy. Yes, part A. Okay, Anita. I was waiting for your live classes, ma'am. Okay, thank you. Thank you so much, Anita. Okay. So let's start with part A. Okay. So before moving to part A, it's very important you have to understand what is part A, right? Okay. So what is part A? What about the timing for the completion of part A? Any idea? What about the timing? What is the total time that, yes. So what about the timing? So tell me, what about the timing? So for total, we have 10 minutes to complete part A, but here we are doing part A within 8 minutes. Okay, clear? Okay, so in part A, we will have, yes, very good Anita, 8 minutes, yes. So, yes, actually we have 15 minutes for the completion of part A, dear, but here we are just going to complete part A within 8 minutes. Okay, okay, ready? Okay, so the topic is, as I already mentioned, it is bullectomy. glitch. Okay, so welcome back. So again we are starting with part A. Sorry everyone. Okay, so yes, part A, it's all about, the topic is bullectomy. Okay, so we have 4 texts, text A, text B, text C and text D, right? So what about the timing? Already you have mentioned 15 minutes to complete part A. But see guys, it is very important, it is we have to complete part A within 8 to 10 minutes. Okay, so yes, so what about the questions? We have match the following questions, then we have question answer sessions, and we have fill in the blanks type of questions. Okay, so this is all about the question answer session. So yes, the question, this is all about bullectomy, as I already mentioned the topic. Okay, so we can read text A, text B, text C and text D within this period of time. Okay, so what about the first question? So we have 1 to 7 questions which are called match the following questions, and see they have very clearly mentioned here, for each question 1 to 7 decide which texts A, B, C or D the information comes from. You may use any letter more than once. In which text can you find information about? So as I already said, it is all about match the following questions. So what is the first question here? Methods for administering pain medication to post-surgery patients. Okay, so what is the answer? Any idea? Can you please tell me what is the first answer to the first question? Methods for administering pain medication to post-surgery patients. And you guys already you know how to answer the set of questions. Okay, already we have marked keywords from the texts. Okay, so that is from text B, right? Okay, very good. It is from text B. Okay, so yes, I am taking text B. Okay, and as you can see here, it's all about procedure. See the procedure. Okay, when you mark the keyword from the question, from the text, already you have marked the title, procedure. So what are the things that you will mark while reading part A? Okay, all the title, all the headings, all the subheadings, the first line from the paragraph, last line from the paragraph you can read thoroughly, all the numbers, all the signs and symbols, then what else? All the names, pronouns, okay, all the symptoms, okay, all the abbreviations you can mark. So likewise we can mark, and we can do it with the technique called skimming and scanning. Already you know about it, right? Okay, so here, what is the answer from text B? Can anyone say? Yes, answer is text B, right? Okay, so where it is? From text B. Is it from the first para, second para, third para or the last para? Where is it? The answer. Okay, so the question was methods for administering pain medication to post-surgery patients. So that answer is in, okay, text B, the last paragraph. Okay, people may need to use oxygen mask after surgery until their lungs are working well enough. They will receive pain medication in the form of an intravenous drip or oral tablets. Okay, so that is the answer, text B. Okay, so what about the second question? The required age constraints in order to get treated with bullectomy. So where is it? The answer, which text? Either text A, text B, text C or text D. Yes, Shiny, very good, last para. Yes, Kavita. Alpna, yes, very good, last paragraph. Yes, already you got it, right? Okay. Second one is text D. Yes, Kavita, very good. It is from text D. Okay. So, and they have mentioned in text D, as you can see, it's all about a table. Okay. Text D is all about a table, and they have mentioned the parameter, the constraints, okay, then indications and contraindications here. Okay, so it is in text D. Okay, very good. It is all about text D. The age, as in the first line itself, they have mentioned very clearly what clinical setting. The parameter is clinical, and in the indications they have mentioned young age less than 50 years. Okay, so it is from text D. Then what about the third question? How should one care for the surgical wound area? Okay, so one care for the surgical wound area, care, management. So where is it mentioned? Which text? The third one. It is from, as you can see from the title, post-operative care. So that is from text C. Very good, Kavita. It is from text C. Okay, from text C. Got it? Any doubts? Okay, then fourth one. When would a doctor advise voluectomy for the patient? When would? Okay, when would a doctor advise voluectomy for the patient? So what is it? What is the answer? Which is from text A. As you can see from the third paragraph, see, doctors may recommend a voluectomy if the bullae significantly interfere with the person's breathing or cause health complications. So that is the answer from text A. Clear? So what about the fifth question? Worsened symptoms of COPD. Okay, so where is it mentioned? Worsened symptoms of COPD. Any idea? Fifth one. Yes, Kavita, where is it mentioned? The fifth question. Yes, Sini. Text A. Okay, very good. Yes. What about fifth question? What is the correct answer? Which text? Any idea? Okay, so yes, fifth question, the answer is text A again. Okay, worsened symptoms. So it is from the which paragraph? It is mentioned in the fourth paragraph. Bullae can cause symptoms of underlying conditions to become more noticeable. For example, a person with chronic obstructive pulmonary disease, that is worsening condition, the worse. Okay, so that is here. So these are the symptoms mentioned. Okay, from text A. What about the sixth question? What conditions would bring about someone ineligible for voluectomy? The contraindications they have mentioned here from text D, ineligible. What are the contraindications? Okay, so that is from text D, from the table itself. Okay, yes. Moving to the last one, ways to expedite recovery post surgery. Okay, expedite, which means what? Speeding up, speed up, accelerate. Okay, so ways to expedite. So which is in text C. So take text C. See the first line. The following steps can help a person speed up, expedite. Okay, their recovery and avoid complications, and these are the things. Okay, so from text C, very easy. Okay, so clear? 1 to 7 questions. Then we are moving to the next set of questions, 8 to 14, and as I already mentioned, these are all about question answer sessions. Okay, so answer each of the questions 8 to 14 with a word or a short phrase. Very clearly they have mentioned you can answer this question within a short phrase. So what is a short phrase? What is a short phrase? Can anyone tell what is a short phrase? Any idea? What is a short phrase? How many words will be there in the short phrase? Okay, so here in part A we can answer the question in a short phrase. It will be minimum or maximum of 3 or 4 words. Okay, 3 to 4 words. Okay, each answer may include words, numbers or both. Okay, so 8th question. What device might a patient require until their lung function returns to a standard state? So where is it mentioned? Okay, for the 8th question, that answer is, take text B. Okay, so where is it mentioned? See the last para. People may need to use an oxygen mask after surgery until their lungs are working well enough. Okay, so that is the answer, an oxygen mask. Okay, so that is the answer. Clear? What device might a patient require? So that is from text B, oxygen mask. Then 9th question. What contributes to generalized tiredness? So generalized tiredness. Okay, in chronic obstructive pulmonary disease. So where is it mentioned? Generalized tiredness, COPD. Where is it mentioned? So which is from, as you already know, from text A. Okay, so what is the answer? What is the answer? Any idea? For the 9th question, it is low oxygen levels. Okay, low oxygen levels. Where is it? Where is the answer? Okay, so that is low. Yes, very good, Abby. Low oxygen levels. Your answer is correct. Okay. Okay, it's not wheezing. It's not wheezing. It is low oxygen level. Okay. So from text A, where is it mentioned? Low oxygen levels. Can anyone say? Where is it mentioned? The low oxygen levels. Okay. So I'll show you from. Yes, see the second last line, general fatigue from low oxygen levels. So what do you mean by fatigue? So that is tiredness. Okay, so that answer is low oxygen levels. Okay, from text A. So 10th question, what existing behavior disqualifies an individual from undergoing bullectomy? So what is the answer for the 10th question? Okay, so that is, okay, Alpna, 5th point, okay, general fatigue, very good. Sanida, second last line, very good, yes, yes. Grishma, second last sentence, very good, yes, you got it, okay. So what about the 10th question? What existing behavior disqualifies an individual from undergoing bullectomy? Okay. Existing behavior disqualifies. Is that air travel? Christina? Okay. Can you take text D? Please take text D, the table. Anything mentioned there about contraindications? Okay. Anything mentioned? So as you can see here, okay. So that is what? In the contraindications they have mentioned about tobacco use, ongoing tobacco use, and that is the answer, tobacco use. Okay, so for the 10th question, existing behavior disqualifies an individual from undergoing bullectomy, disqualifications or disqualifies. So that is in contraindications, right? So answer is tobacco use. Okay, so moving to the 11th question, what activity should be abstained from for 90 days following a bullectomy? 90 days. As you already know, you have to mark all the numbers and everything. Okay, maybe years, days. So whatever it is, 90 days mentioned in which text? Any idea? Maybe in the form of weeks, months or whatever, 90 days. It's not air travel, dear. It's what? Tobacco use from text D. Okay. So what about 11th one? What activity should be abstained from for 90 days allowing bullectomy? Okay, that is air travel. 11th question, very good. Deepthi is air travel, Kavita air travel, Anu air travel, Sini, okay, Shiny, okay, it is air travel, very good. That answer is air travel for the 11th question. So my question is, where is it mentioned 90 days? Okay, where is it mentioned 90 days? 90 days mentioned anywhere? Okay, so from the second last line, doctors recommend avoiding air travel. That is the answer. Now, instead of 90 days, they have mentioned 3 months after surgery. Okay, so see 3 months. That is 90 days. Answer is air travel. Okay, good. So the next question, what is the structure? What is the structure that dominates a significant portion of the space within and around the lung called? So what is it called? The structure. Okay. So that answer is, what is the answer? Any idea? Okay. Okay, Grishma, what is the answer for the 12th question? Any idea? Okay, Alpana, Srija, Anu, Kavita, Deepthi, tell me what is the answer for the 12th question? Giant bullae. Very good. Okay, that is the answer. That is a giant. That is the structure. Okay, giant bullae is the answer. From which text? Text A, text B, text C or text D? Which text? Okay, so that is from text A. Okay, so that is from text A. Answer is giant bullae. Okay, so see the second paragraph. Those that take up more than 1/3 of the space in and around the lung are called giant bullae. Okay, that is the answer. Okay, so very next question, 13th one. Which diagnostic modality is capable of discerning deficiencies in target zones and insufficient washout in the residual lung? So, what about the 13th question? Any idea? Okay, Srija Jain Pullai, Jia Jain Pullai. Yes, very good, very good. It's very easy, right? Okay. What about 13th one? Any idea? Any guess? 13th question. Okay. Which very good, isotope scan. So that is the correct answer. I'm very happy you guys got the answer. Okay, Deepthi, isotope scan, very good. Christina, okay. So answer is from text D. Okay, as you can see from text D. Okay, so isotope scan. Absence of target zones, poor washout in remaining lung. Remaining, that is called residual. Okay, from the question. Okay, so residual lung modality, diagnostic modality. So that answer is isotope scan. So what about the last question from those set of questions, 14th one? What dietary elements increased consumption can alleviate constipation, can prevent constipation? Okay, so what is the dietary thing or what is the dietary element? Okay, factor. Very good, fiber. That is the correct answer for the 14th question. It's all about fiber from which text? Text C. Okay. So that is from text C. Eating a diet in high fiber to help to prevent, alleviate constipation. So that is the answer, fiber. Okay, very good. Okay, Grishma, fiber, shiny. Okay, Srija. You don't have to write high fiber, it's fiber because the question is all about what element, what factor. Okay, so that is fiber. You don't have to write high fiber. Okay, Jaya, clear? Okay. Okay, B, it is not high fiber, it is just fiber. Okay, Sini. Yes. Okay, text C, very good, yes. Okay, then the next set of questions, 15 to 20. Same thing, complete each of the sentences, 15 to 20, fill in the blanks type of question with a word or a short phrase. Again, word or a short phrase from one of the texts. Each answer may include words, numbers or both, the same thing. Okay, so 15th one, despite the dash nature of bulectomy, the procedure necessitates the individual to undergo general anesthesia. You got 7 out of 7, very good, Abhi. Okay, yes. Okay, so coming back, what about the 15th question? 15th one, any idea? 15th one. Despite the dash, nature of bulectomy, what is the answer? 15th one, it is a filling the blanks type of question. Okay, so tell me, what is the answer for the 15th question? Okay? Okay, Manjusha, one of the best teachers and the brilliant reading expert I have ever seen. Thanks, ma'am. Cherish those valuable classes with you. Thank you so much, dear. Okay, I'm so happy hearing those words from you, dear. Okay, so coming back to the question, what was the question? It's all about, okay, fill in the blanks. So what is the answer? You can take text B. So see text B. Okay, what is it mentioned? See the first paragraph, a bulectomy is a minimally invasive procedure. That is a question. A bulectomy is a minimally invasive procedure. So what is the answer here? Minimally invasive. Clear? Okay, and what about the next one? Physicians might advise a bulectomy when the bulli exert a considerable impediment on an individual's dash efficacy or precipitate health complications. So, where is the answer? It is from text A, as you can see from the third paragraph. Okay, doctors may recommend a bulectomy if the bulli significantly interfere with the person's breathing. Okay, so what is the answer? It is all about breathing. Okay, so coming to the next one. Okay, 17th question. Subsequent to the surgical procedure, the patient is cautioned against engaging in swimming, strenuous activities, then what else? Participating in golf for weeks spanning up to. So that number of days or weeks mentioned, which was in text C, as you can see here. Which point? The fourth point, right? Okay, avoiding lifting heavy objects, swimming or playing golf for 2 to 3 weeks. So that answer is 2 to 3. Okay, answer is 2 to 3. You don't have to write weeks because already it is mentioned in the question. Clear? So 18th one, dilated and compromised dash in the lungs termed bullae are subject to removal via a surgical technique called bullectomy. So what is the answer for the 18th question? It's all about text A. Okay, see the first sentence. Bullectomy is a surgical procedure that involves removing bullae which are enlarged, damaged air sacs, okay, in the lungs. So that answer is what? Air sacs. Okay, so what about the 19th one? The surgical procedure known as dash, surgical procedure, already you have heard this term, the procedure, surgical procedure. Okay, so that is what? Video assisted thoracoscopic surgery, or else you can write VATS from text B. Okay, second paragraph, second line. They will use a small video camera to help guide the surgery, which is called video assisted thoracoscopic surgery or VATS. Okay, so that answer is either, you can write the abbreviation because it is already mentioned. Okay. Then the last question, dash can detect prominent bullae with vascular congestion surrounded by compressed pulmonary tissue. Okay, so what is the answer? It is in text D in the table, as you can see here. Which line? Okay, so in the imaging, see the second one, CT, large and localized bullae with vascular crowding and normal compressed pulmonary parenchyma around bullae. Okay, so that is CT. That answer is CT. Okay, so the end of the discussion. Clear about everything? So how many of you got 20 out of 20? Anyone with 20 out of 20 for part A? No 20? 19? 18? 17? 20 out of 20, very good Abhi. Okay, you got 20. So what about others? Very good. What about others? Anyone with 20 out of 20 for part A? 18, very good Shiny, good enough. Then, okay Jia, okay, what about your marks? Okay, it's okay. So yes, I hope it is clear for you. Okay, so when you are attending the live session, I mean during the live session and after the live session, maybe you will get a lot of messages from fraudulent people, okay, or from fraudulent institutions, so don't fall for them. So please, if you have any doubts or any concerns regarding the session or our classes, okay, so you can contact the number mentioned here on the screen. Okay, so that's that. So yes, 17, very good. Okay guys, so take care, good day, thank you.